Hi, it's Friday, April 10th, and I'm Trisha Gardner, Public Health Officer for Cascade County and the City of Great Falls. We've continued to receive a lot of questions about testing and who is considered a contact. I want to shed some light on these topics today. Every time we get a new positive case, CCHD's infectious disease team quickly conducts an investigation and reaches out to each person who is identified as a close contact. Close contact is someone who has been within 6 feet of a known case for a period of 15 minutes or more. Those contacts are put into a 14-day quarantine, educated about COVID-19, monitored daily for symptoms, and told to contact the health department to coordinate testing if they become symptomatic. Please be aware that if you are a close contact of a known case, we will call you as quickly as possible so that we can prevent the potential spread of this virus. If you haven't been identified as a close contact, it's still possible that you could be exposed to COVID-19. There are several symptoms to watch out for. Keep in mind, sometimes these symptoms can be quite mild. You should get tested or act as if you have COVID-19 and isolate yourself for 14 days. Most common symptoms include cough, shortness of breath, fever, body aches, and fatigue. Less common symptoms include nausea, vomiting, diarrhea, and abdominal pain. If you experience any of these symptoms, isolate at home until the symptoms fully resolve. Most people can recover from COVID-19 at home without medical attention, but they still need to be very careful not to potentially expose anyone else. Isolating at home includes staying at home except to get medical care, separating yourself from other household members, avoiding sharing of personal household items, disinfecting high-touch surfaces every day, washing your hands frequently and thoroughly, wearing a cloth covering over your nose and mouth if you are sick, and monitoring yourself for worsening symptoms. If symptoms worsen and you become worried, call your medical provider or one of the hotlines set up by Alluvian, Benefice, or Great Falls Clinic. If you need to call 911, tell the dispatcher you are currently experiencing respiratory illness symptoms so that first responders can properly prepare. Also let the dispatcher know if you have tested positive for COVID-19 or if you have been tested and are awaiting results. If you are able, put on a face mask before help arrives. Please act as if you could get the infection at any time. Even if you've already recovered from COVID-19 or if you were tested and didn't have it. The immunity status of people who have been previously diagnosed with COVID-19 and have recovered is not understood at this time. That is to say, we don't yet know if catching the virus once is protection against future infections. If you feel your symptoms might be COVID-19 and you are going to seek medical care, again, call your medical provider or one of the hotlines before arriving at the facility to let them know you are coming. That way, they can take appropriate precautions so that no one else is exposed. Calling ahead is a simple way to protect our entire community and our healthcare workers. As usual, we'll update our Facebook page later this evening with the number of cases in Cascade County. Please call us with any concerns or questions at 454-6950 or email CCHD at health@cascadecountymt.gov. Stay home, stay safe.